Marcel. So we've heard a lot about the context and what's happening, and certainly I have to point out that in some ways Wagga is a fortunate area in the sense that they've got some fantastic paediatricians. Within Wagga itself, there are quite a few services, but these are common stories that we hear not only right across New South Wales, but in other states and territories as well, and even worse in some cases. So I just wanted to make that point. Marcel, over to you. What role then does the Royal Far West play in this ecosystem, and what are you seeing with the children and families that are accessing our assessment and diagnosis service? Can you provide us with a bit more colour around that?
Yeah, so I think, we're seeing, as we've talked about, a real, increase in complexity of the kids coming to our service over the last 7, 8 years. And I suppose we've alluded to some of those factors and probably just worth naming again. I mean, I think the population we see has, if you like, a base layer of often social disadvantage, obviously remoteness and postcode and ruralness is, as we know, on so many factors, a disadvantage, unfortunately, many advantages. And the service gaps we've talked about, intergenerational problems that I think they can obviously be in the city, but there are those in the country, as Theresa's alluding to. And I think just to reflect on what we're seeing in the last few years is, I suppose, the post-COVID effect. I think when you've got that base layer of challenges in a society or communities, you add a major social upheaval such as COVID, which has just spun out services, all of us, but you're starting from a more difficult point in a lot of communities. So there's that. And then obviously you add the rural factors of drought, bushfires and floods. Maybe Riverina doesn't have as direct effect. I suppose a lot of our other regions, there's that roll-on effect, and we're seeing that more and more. I'm not dismissing that there's been floods and droughts in the Riverina, but there's some other regions, but you probably see that. And then you add, of course, because of all of that cost of living pressures, I imagine as well, just pushing these factors up is, another layer, if you like, of complexity coming through to family difficulties, mental health issues, parent stress, child stress, and the child's not being seen. So I suppose that's some of the effects or impacts we feel we see here across the state. And then, when you add the shortages in accessing the services as well, we try and fill those gaps. So essentially, if we think, and there's some great cases we'll reflect on in a second of how it can work, not perfectly, but really well. But we try and fill those gaps as much as we can across the state, obviously in some other states as well in some of the work we're doing. But in terms of our assessment service, we're trying to provide the kids and the families with an opportunity to have a very comprehensive assessment, when they need it. We do that here and on telehealth, and we're getting those referrals from general practitioners still and through paediatricians as well. And so, it won't be a barrier if a child, so sometimes there are kids, because understandably they might be falling in the gap of the public and private, and their GP does a referral, and then we'll try and, loop back to the paediatricians for aftercare. So we'll try and fill any gap to, particularly in the assessment service, provide a child and family with comprehensive assessment. Should I talk a bit more about what that looks like, or maybe we can talk through the cases?
I think it would be good to, because it's one thing to talk about complexity. What does it actually look like? How does that play out for a child?
Definitely. Well, I think we could start with the older kid that Theresa and I shared a while ago, and then there's a younger kid that's very kind of top, for us, we've been talking about over the last few months. So we can paint the picture together that the child we're thinking of is a girl who's now 9, 10, who I think you referred to us back. Oh, the microphone.
I referred her would have been 4 years ago now.
Yeah.
3 or 4 years ago.
Before COVID, I feel
Yes.
with I think there are some language concerns, certainly some behavioural challenges.
Lots of behavioural challenges and lots of social issues.
Yeah.
Mother particularly was just not coping with her behaviour, and the teachers had highlighted a number of issues at school with her learning, with her development and her interactions with the other children. There was lots of stealing going on, and she was hoarding various things. Concerns about her social interactions with other kids. And so the main reason I referred was because there was a question of whether this child had autism, but also to deal with all these other very complex behaviours that were going on both at home and at school.
And back then was possibly the same as now, just to look back, if it wasn't referring to Royal Far West, what were the possibilities then, and I suppose now, for an assessment like that in that region or your region?
So the only other possibilities for an assessment would be privately in our region, and that costs $3,000 at the least, which for most families is completely unaffordable. This family live in Temora, so they're about an hour from Wagga, and I usually see her by telehealth probably 3 out of 4 appointments in the year, because they don't have enough money to pay for petrol to get to Wagga, and often the mother's car's not working. So for them to then be asked to pay $3,000 for an assessment that could actually open doors for therapy for her and help the school and parents understand why she is as she is, was just beyond anything they could even comprehend. So without Royal Far West, there would be no option. She would remain my patient, and I would remain, well, she would remain my patient, but I would continue to not know the answer, I think.
And so I think that we got to know the family quite well over at least, I think, 2 visits here. And what kinds of things do you feel you got and they got from seeing a whole range of clinicians here over a kind of, 6-12 month period? What kinds of things, were helpful?
I think there was a great insight into what made her tick. So what she had here was multiple weeks where a variety of clinicians, so ranging from teachers, occupational therapists, a speech therapist, psychiatrist, paediatrician, there was a whole range that were able to be involved with her and her family and could see her over a period of time rather than just the hour that I could spend with her in the office or over telehealth. So that was the biggest advantage. And the social worker here, I remember just being fantastic, just helping the mum so much, working through all the social issues and behavioural issues that she was struggling with.
And I suppose we always, I think, get that time and space with the families for those who can come. And it's great to hear it felt like we got to that point where there was some deeper understanding for the child. And I think that the child, as it turned out, we didn't think was on the autism spectrum. There was a lot of other things going on, but there was a lot of social complexity in terms of helping the mother understand the child and mum, which we got that time to do. And I think we had at least 1 or 2 case conferences. The local GP was very involved. It was a small town, so they were very involved medically, and also so I think that was very beneficial. I think that was pre-COVID. We were doing telehealth then, but we got you to beam in, and we had a meeting, I think, I can't recall if there was by then a local clinician involved at Allied Health.
I think they were trying to link.
They were trying to, yeah. But at that point, I think it was the doctors involved in ourselves, and I think that was helpful.
And Marcel just asked me as we were having drinks, how she's going, and I said to him, well, I haven't referred her back to you, so all must be going okay.
So that's great to hear, and it's been several years, and I suppose we filled that gap and handed back to local care. We're always open for repeat visits down the track, but I think in this situation the model worked really well. And then yeah, the young girls getting the support, you know, locally or by telehealth, but everything's able to stay local now.
And local to the point of tomorrow, that she doesn't even have to access a larger town of Wagga, let alone anything more. So I think it's been a real success story for that family.
And school, just how does she?
And yeah, school are happy. Yeah,
She's happy at school.
And she's happy at school, so she's going really nicely.
And we're reflecting whether there were gaps. This is a leading question. Reflecting back on things that we being Royal Far West, or you and me may have done differently, or things, I don't know, any reflections on that, or things we couldn't do now that we could do then? I don't know. I suppose we can still access, I suppose, any gaps then that are still there, or yeah.
I think sadly the gaps are still there.
Yeah.
So, you know, if I have her 4 years down the track, I would probably have the same issue in that I couldn't get a private assessment because it would just not be financially possible for this family.
Mm.
I mean, even travelling up to Sydney is really difficult for them, the petrol money and taking a week out of work. And while we sort of sell it to our families, oh, you get a week on the beach and you know, what fun. It's actually really hard for families to do that. So
Yeah, and obviously somehow they manage to do so. The situation, there is some of the funding isn't there in test, but that doesn't cover a lot of it or all of it.
And it is worth it for families. I mean, as most of you will know, with your own children or nieces or nephews, that you put your child number one always first and willing to do anything, and that's what it involves.
I suppose it makes me reflect, and then we can talk about another case with some slightly different kind of concerns. But you know, as a ballpark for both of you, there are kids, I suppose, you see that couldn't make it to us in our current model for assessment. We do have some other kind of services Royal Far West offer, but we're talking about our comprehensive assessment service. It's telehealth, and then here, you know, what proportion of kids, let's say, would you see that you think, look, I'd love to send them to Royal Far West, but we know that they don't have the means to get here? I don't know. Is that an often or sometimes thing? I don't know.
No, I think it's relatively often. And our outreach clinics, which we've alluded to, where we visit the smaller towns, and it's a publicly funded clinic, I think has opened us up to seeing a lot more of these complex kids, which would just not even have interacted with a paediatric service otherwise. So I think in terms of the kids that can't access these assessment services, it's probably increased, but because we're seeing more of them now as well. And it always surprises me. I mean, you sort of think I live a sheltered life sometimes, but, you know, even going out to their town, and they might live in the next town, but the car's not working or there's no petrol. I just find it really hard to comprehend that, but that's reality for people, that they, even though the medical appointment is planned, they can't get there for physical reasons, or, you know, parents' mental health aren't good enough that day, or whatever it means. There's just so many barriers to access.
And if they do need to drive to Wagga even to see you, I imagine for a lot of families, and we hear this, that drive, for us, it might only seem like an hour, but as many of you would know, when you've seen your patients, that's a huge bridge sometimes, or a huge barrier even just to get into Wagga if they need to.
While coming to Sydney puts my blood pressure up, for many coming to Wagga puts their blood pressure up. But we do have a McDonald's for them, which is often a bonus, of McDonald's and a Kmart.
And the Murrumbidgee Beach.
And the beach, that's right.
Maybe we talk about the family and the child we've been seeing recently, which I suppose highlights the complexity in terms of parental mental health, and how, well, firstly, how things can work really well in a collaboration with local and, let's call us remote for a second, but a hub and spoke kind of model of care. This is a family perhaps who can access and come to Sydney more easily, perhaps. So some of those, I feel like, rural factors aren't there as much, but certainly a lot of the service gaps and how an outside service can work with the local team can be really helpful. Should we talk about that? And maybe you just paint a bit of a picture of this child, and they've come from one of your colleagues, and yeah.
So this is a little 3-year-old girl. So I guess, for want of a better word, inherited her from one of my colleagues who moved overseas. And so I actually only met her for one sort of half an hour appointment before our involvement with Royal Far West. So this is a little girl with a lot of parental reported medical concerns, who had been referred by the GP to multiple different subspecialties throughout Sydney and had a lot of, I guess, invasive medical procedures performed, and also a lot of report about serious behavioural and developmental concerns, which when I met her for the first time just didn't add up in my consult room, that the picture that was being painted and all of these reports that I had from various sources didn't look like the little girl in front of me. So she was referred up here to Royal Far West to, I guess, gain a better understanding of the whole picture, where we could be in an environment where over a period of a week or 2 weeks that we could get a lot of eyes on her in all different contexts and with both the child and family unit. So she's been seen relatively recently over the last couple of months, and that's been absolutely invaluable to get the insight of the team up here at Royal Far West as to what's happening within this family unit.
And that's good to hear. That was our hope, because I think being outside of the community allowed us, and looking fresh at the family and the child and the medical history that we had, we could have a unique perspective on that, and then hopefully target the supports in the right way. So that, unfortunately, involving this situation, there was a meeting that we convened that Leah attended as well with child support services and child and family services to kind of map out what was going on and child safety issues. A very complex case, but that was great that Leah could join in, and we've had subsequent contact and planning to ensure that consistency of care, which is really important in this case, so that the child and family stay, with the oversight of one GP, which again, I think, as we've talked about in Wagga, I think financially this family may have the ability to access a private GP, but again, going back to that workforce issue, not as easy to say they really would be great if the child saw the same GP. It's great they can see Leah ongoing, or if Leah's away, she can hand over to one of the colleagues. I suppose the question I had to Leah was where, in this situation, again, it was your colleague that did the initial referral to us before they went on leave or whatever, but, if you were seeing them tomorrow again, where could you refer, knowing that perhaps the child was actually developing quite well, but needed a very comprehensive team to help the family realise that the child was developing well? Where could have those referrals gone?
Yeah. So again, locally, our only options for developmental referrals are privately.
Yeah.
And in this child, when, I guess, from a clinician perspective, she clearly didn't have autism, which was the mum's concern, referral to a private psychologist would not have been the appropriate referral pathway. We do have some other developmental services, again, up in Sydney, but they're the sort of services, either public or private, where they're only going to see the patient for sort of half a day, sit in a room with a paediatrician and some therapists, and not sort of get the benefit of that holistic picture of what's going on in this family. So again, they will say, well, this child doesn't have autism spectrum, her development is largely on track, but that wouldn't have provided the same sort of service and outcome that we had by her coming up to Royal Far West and having that time and space to really get a better understanding of the family dynamics and what's going on for this child.
I mean, I think that's given you a bit of colour around certainly complexity and why, you need a service like Royal Far West. So it's pretty unique in terms of what it offers, in terms of that holistic picture. And you actually touched on something I was going to ask next, which is a bit off script, but, an assessment is one thing. How well, number one, how important is the assessment in terms of making a change for a child or improving the outcome? And then, you know, how important it is that follow-up, and can you have one without the other to really get the best kind of outcomes for kids?
I think given the complexity of the children that we're talking about, it is very hard to have one without the other. So the assessment process is really important, but then usually from Royal Far West, we receive a very long, comprehensive report, very useful, from where everybody's had their say, and at the end of it, there'll be a page of, I don't know, 10 recommendations, and they're extremely helpful, but then you need the next step to say, well, is this actually working, or do we need to reconsider a diagnosis or reconsider our management? So I think the follow-up is crucial.
I would agree with that. So in the assessments, is it really beneficial for us to get an understanding of what's going on and to guide that further follow-up? But a diagnosis doesn't really help us if we can't then manage it by the follow-up. Yeah. So if we don't have the services on the ground that can help manage it, what does it matter whether the kid's got a diagnosis or something or not? It's all about their function, and therapy and follow-up is functional improvements.
I think that goes to one of the challenges that we're seeing here at Royal Far West and that we're grappling with. And it is important to note and touch on, this is a completely free service for our families. This is where all of our donations, all of our fundraising goes towards actually supporting the cost of this program, because we do have a grant from New South Wales Health to deliver these assessment services, but there is an expectation that we make a co-contribution. But most importantly, our families come down here, they cannot access IBTAS, which is a travel subsidy, but when they're here, we completely wrap around our families. We provide them with food, shelter, accommodation, and that does not cost them anything. And, you know, I think that the other vital part around having many eyes on kids, I think that's one of the really unique parts of the service too, that kids and their siblings often attend the Royal Far West School, which is just upstairs here and integrated into this model. And so our amazing teachers, which are Department of Education teachers, are really important in part of that assessment service. But we even run a rec program after school, and even those insights in that kind of social environment feed into that diagnosis, and then of course all of the work with the clinicians. But really importantly, it doesn't stop there, and you know, our model really is about connecting kids to care locally, but also really building the capacity of the parents while we're working with parents, and most kids we are in our service for at least 18 months to 2 years, and so we have lots of opportunity to try and build the capacity of parents and support them in this job of managing kids with sometimes really difficult behaviours, and helping them understand why that's the case. But also, you know, I think that importantly, the way we've had to run this service has really changed in recent years, and this is one of the reasons why we're having this session today, because as we've heard, the need is growing. The Royal Far West service is fairly unique and is what's required for these kind of complex cases, this kind of multidisciplinary assessment model. So more kids are coming through the front door. Often the assessment time is taking longer because there are all of these complexities to unpack. And then, you know, where we used to transition most kids back to local services, very few children can now be connected back into local services because they're just not there, as we've heard. And so that means Royal Far West is having to hold on to children for longer. And many children that we're really worried about their safety, and Marcel touched on child safety, and that's a whole other range of case studies we could talk to you about. But at the end of the day, our government funding is not increasing. And so this is where we need support from government to provide and fill these widening gaps, I suppose. And it's just really important, I think, to note that's a really important reason why we're here tonight, to understand that this isn't just status quo. The situation has changed, not just for Royal Far West, but for services everywhere that are really struggling with these issues. We did touch on a little bit about early intervention and what happens when kids don't get access to these services and the kind of life trajectories they can have.